Good morning and good afternoon and good evening. I'd like to start by thanking everyone for joining this webinar. Today's panel is the final event in MEI's four-part series in cooperation with Arab Barometer, the longest standing and largest repository of publicly available data on the views of ordinary citizens in the MENA region. Arab Barometer's most recent poll assesses regional perspectives on COVID-19's impact on public health, domestic conditions, vulnerable populations, and the way the region sees the outside world. I'm delighted to invite our experts to discuss their findings and perspectives relative to COVID and gender. Today, we'll hear from Dr. Amaney Jamal, co-founder and principal investigator of the Arab Barometer. She's also an Edward S. Sanford Professor of Politics at Princeton University. We'll also hear from Dalal Yassin, a non-resident scholar at the Middle East Institute, and Lina Abu Habib, who's the Senior Gender Advisor at the Asfari Institute for Civil Society and Citizenship at the American University of Beirut. We'll begin by inviting Amaney to share Arab Barometer's most recent polling results. Then we'll ask Dalal and Lina to respond. And finally, we'll ask the audience to post questions in the chat box. With that, welcome everyone. And Amaney, you have the floor.
Thank you so much, Rafiq, for that very kind introduction. It's really a pleasure to be cooperating with you on this seminar series. We are absolutely delighted in the Arab Barometer, and I'm really thrilled that Lina and Dalal are joining us to offer feedback. I want to thank you for your time and efforts in advance. So with no further ado, I will transition over to the talk. Now, Rafiq, should I share my screen or do you? Okay. So everybody can see my screen? Excellent. So thank you so much. So today's presentation is focusing on women and COVID-19 in MENA. These are findings from the sixth wave of the Arab Barometer. Just a brief note about the Arab Barometer. The Arab Barometer is the longest standing and largest repository of publicly available data on ordinary citizen views in MENA. Arab Barometer has tracked views of ordinary citizens across MENA since 2006, providing insight into changes over time. And the Arab Barometer goals are to accurately track attitudes and behavior of ordinary citizens, build institutional capacity to conduct survey research, disseminate knowledge about ordinary citizens living in MENA to inform civil society, government, and international organizations. Briefly, we have conducted over 90,000 personal interviews to date. We have administered 70 nationally representative surveys, 6 waves across 15 countries, providing trend data on how views have changed from wave 1, as you see here, all the way to wave 6. Today, we'll be focusing on wave 6, but what we are very proud of is that all of our data is publicly available. Please visit arabbarometer.org. We have an English website and an Arabic website. For Arab Barometer, the sixth wave, which we conducted in 2020 into 2021, we conducted the surveys due to the COVID pandemic by phone. This is the first time that we moved to phone surveys. Typically, all of our surveys are face-to-face. And in this sixth wave, we conducted 3 rounds of phone surveys. July through September 2020 was the first phase. October 2020 was the second phase, and March through April 2021 was the third phase. We based this on a sample of 1,000 respondents per country using random digit dialing techniques. And we, of course, work with our partners in the region. Some of the key findings of today's survey results and the presentation is that what we find is that on average and across the board, women are far more concerned about COVID than men. COVID-19 increased family stress and burdens on families across the region. Perceptions of gender-based violence tended to decrease during the pandemic. And in fact, what you'll see is that a lot of families reported, members of families reported that the family became more unified during the COVID pandemic, but we will see some separation on economic status that I will show in just a bit. And when we think about one of the key fundamental issues, which is the low percentage of women in MENA labor force, the low percentage of women in labor forces across MENA, we are now examining some of the structural barriers. Oftentimes people talk about cultural barriers, economic barriers, and other structural barriers. What we show is that although we find that cultural barriers do matter, the structural economic factors are far more important for how women and men assess the low percentage of women in the labor force across the region. Okay, so moving first to women and COVID, what we find here, it's a lot of data that we try to capture in one slide, but basically this is looking at 6 countries where we conducted the surveys over the 3 time periods. We did surveys in Iraq, but we were only able to do the last time period in Iraq. So when we have trend data, we're not presenting the Iraqi results. What we see here between July to March, July 2020, October 2020 to March, April 2021, is that in some countries, the concern about COVID spreading over the next 6 months declined, like in Algeria, in Morocco, in Libya, where sort of COVID was getting much more under control. But in other countries, like especially like Jordan, where COVID progressively worsened during the year, you'll see that concerns became far more serious. And across the board, what is interesting here is to note that women, which is the light blue bar, versus men, the sort of orange bar here, women in every single country were far more concerned about the spread of COVID than men. I'm going to move quickly because we have several slides, but I hope Lina and Dalal will ask me questions about these or ask me to put them back up if we need to. This is also to give you a sense of some of the concerns about COVID that women expressed. So here's that earlier time period, July through October, versus the second time period, March through April. The biggest concern for women was family members becoming ill or facing death. And you see that in every country, this was the #1 concern. In some countries like Tunisia, the concern increased across time. Morocco, it increased. Lebanon, it started out very high because this is probably, Lebanon suffered from COVID early on. The spikes in COVID were very severe. This lesson in Jordan, women, 39% expressed concern about family member illness or death. In the first time period, by the third time period, that percentage had increased to 61%. So again, this tracks well with what was happening with the pandemic during this time period. When we ask respondents, what are the 2 biggest challenges you face due to the spread of the COVID-19, the percent of women and men who say adverse effects on their own mental health, you'll see that on average, women slightly experienced more adverse effects due to mental health. In Iraq, it was 40 versus 34% for females versus men. Morocco, 39% versus 31%. Jordan, small difference there, 3%. But across the board, I mean, I think the story is that in Tunisia, 21% of women said that they experienced mental health issues versus 13% of the men. So although some countries also had it worse off than others, in each country, what we find is that women were suffering a little bit more. And this is probably because of, kids being home from school, financial stress on families, things of that sort. Women and the pandemic at home. We like to track some of these gender-related issues across all our surveys. So one of the questions we ask is taking care of the home and the children, is that a woman's primary responsibility? And so the percent of people saying they agree or strongly agree, on average, you'll see that almost in most countries, the majority of citizens, both men and women, believe that taking care of the home and children is a woman's primary responsibility. What's interesting here, so although it's typically the majorities in all these countries, except in Libya, what we find is that men disproportionately support this opinion more than women, almost by a fraction, a double of the 31%. What is interesting here is that we see that it's almost a majority opinion, but in all the other countries, the separation is not severe. So women clearly believe that that this is their primary responsibility. Another question that we track: a man should have final say in all decisions concerning the family, meaning like the man's word is sort of like the final word. What we find is that, again, here it's I think a little bit more gendered. In Jordan, 60% of men agree with this, while only 39% of women agree with this. In Iraq, 52% of men versus 47% of women. In Libya, again, a huge gender gap on this question, 64 to 28. In Morocco, Algeria, we don't really see the separation, and it's close to 50%, almost close to a majority, almost half the population, both men and women, see this. In Tunisia, we do see gender separation. Men are far more likely to support this than women. And in Lebanon, we see a similar trend, although Lebanon seems to be both on this question and on the family responsibilities question, maybe seems to be a little bit to be the most progressive on these issues. Family unity during COVID. The percent of people said that the family unity increased during COVID. You'll see that women in Algeria, 57% of women believe that the family unit became stronger. Across the board, women tended to believe that the family unit became stronger. And then when we break this down by economic status, we wanted to see if there was a difference, based on income. With more affluent families, typically more affluent families can afford to do things with the family at home that poor families couldn't, and they probably also have more space in their homes, which I think made it easier for families during the pandemic when everybody was home. But we don't really see a huge economic separation on this question. Maybe in Jordan, 55% of people who reported they can cover their monthly expenses versus 48% of those who said they couldn't. Libya, it's another 7 percentage point separation, so the separation is not big, but on average, it's sort of encouraging to see that, on average, the percentage of families that reported that unity increased, it seems quite impressive. I mean, given what we know about the devastating consequences of COVID on family life across many different societies in the OECD and non-OECD countries alike. In terms of verbal arguments at home, did verbal arguments increase between family members? A third of all respondents in Jordan said yes. Tunisia, close to 27%, 26% for men. Libya, about 1 in 5, or 1 in 4 if it was men. But again, it's not huge majorities. And then when we look at this in terms of socioeconomic status, we wanted to see if poor families experience more conflict. Again, in Jordan, we do see it's about a 10% separation, with poor families saying that there were more verbal arguments at home between the families. But in Tunisia, it's a 5% spread. It's a 4% spread in Algeria and Libya. It's a significant spread, almost double, from richer families to poor families. In Morocco, it's a 7% spread. But again, the numbers is about less than 1/3 of families have reported the verbal arguments increasing. We also asked physical arguments. This is a very sensitive question. We're not surprised that most of the people responded with don't know or refuse. But we are also sort of encouraged by the percentage of people who said that physical arguments decreased during COVID. 17% in Algeria versus 4% in Algeria who said that it increased. In Jordan, we're not really good. This is not really working for us. People didn't respond. Libya, 17% said it decreased. Morocco, 26% said it decreased. 18% said it decreased in Tunisia. Here are the percentages of people who said that it increased. I think this is a very sensitive item. If we were going to ask this question again, we'd probably rethink how we were going to approach it, given the number of don't knows and refuses. Community levels of gender-based violence. We asked general perceptions. Do you believe that gender-based violence has increased during the pandemic? And we track this question across time. In most countries, at least among women, In three of the countries, we see that the percentage of women said that it declined. That was in Morocco, Tunisia, Algeria. In Jordan, it increased. In Lebanon, it increased. So although people personally didn't report that arguments and conflict and gender-based violence was happening in their own homes, when you ask them about what was happening in the community, I would say, based on also where the starting points are, like in Tunisia, 75% in July, October said that gender-based violence had increased. The perception is that there was a lot of violence. So this is something that I think needs to be investigated further. It could be that people, given the sensitivity of this topic, people didn't want to report about their own personal experiences. We sort of see this with victims of domestic violence and whatnot, but that the perception, maybe what people were hearing, was that the situation was far worse. I don't want to say anything definitive, and I'm really curious to hear what Lina and Dalal have to say about this as well, because they work in the region and they're tackling these issues head on. This is just a chart sort of like showing you the trends of the COVID spikes in the region, in terms of where our survey, where our survey was. So I know you can't, I'm trying to get rid of this thing. Okay, well, anyways, this is the period of our survey. You'll see that Jordan, Lebanon, and Jordan and Lebanon are the two countries that probably witnessed the highest spikes during the pandemic. And then I wanted to say a word about women and employment. This is like one of the biggest structural problems in the region when we look at the lack of women in the labor force, or at least the low percentage of women in the labor force. So when we asked about the percent of people who say they are employed or self-employed by gender, as you can see, there's a huge discrepancy between men and women in the region. Algeria, if you look at the last time period of the wave 6 in March, April, the separation is approximately 50 percentage points there. In Morocco, between men and women, it's about 40 percentage points in Jordan. It's about 40 percentage points in Lebanon, almost 60 percentage points in Libya, slightly better in Morocco, but you see a decline of also male employment there during the pandemic. And in Tunisia, you're seeing a decline. So this gender gap in employment opportunities, or at least employment period, seems to be ongoing and very dire. If you also look at the small declines during COVID, you'll see that more women fell out of the labor force during the COVID pandemic. Now, we ask questions about, to what extent do you think the following poses a barrier to entry for women in the workforce? These are items that we sort of have gathered from our conversations, our qualitative work in the region. So the options are the lack of transportation to work, the lack of childcare options, mixed workspaces, meaning mixed gender workspaces, low wages, and that men are given priority. And the men given the priority is sort of our cultural patriarchy indicator, like is the idea that the labor force is always just going to prefer men because of a culture, an ingrained culture of patriarchy. And what we find is that, let's just look here on the left of every single country, Algeria, Iraq, Jordan, Lebanon, Libya, Morocco, Tunisia, the number one issue tends to gravitate towards either the lack of childcare options for women, or the lack of transportation. So in getting women to their sites of work appears to be a very serious issue. These are the two key issues in Algeria, in Iraq, in Jordan, and I would say in Lebanon, it's really just the lack of childcare options. In Libya, it's up there. It's with the low wages issue. Morocco and Tunisia. These are the two sort of most central features. Low wages comes in third in almost every single country, or second, let's say in Morocco, or first in Morocco, but there's not much separation between these. Libya, it's also up there. In Lebanon, it's the second. In Tunisia, it's the third, sorry. But the low wages is a big issue. In other words, and a lot of women will report, well, if I'm going to have to struggle with childcare and figure out my childcare issues and then pay for transportation and by the time I get my paycheck, I'm going to be I'm going to be in debt because I have to pay childcare and transportation. So it just doesn't make sense for women to work. So that's sort of like an economic structural issue. But I do want to look at the mixed workplaces and the men given priority issue. This was not inconsequential, the mixed workplaces. 31% of people reported that that this was an issue for them to work, for women to work in the labor force. 31% in Algeria, 33% in Iraq, 41% in Jordan, 27% in Lebanon, 34% in Libya, 22% in Morocco, and 25% in Tunis. So like 1 in 4 in Tunis, and Tunis, Lebanon, who tend to be the more progressive, you're seeing about 25% of people still supporting this issue. It's an issue. So that's something that, you know, what we want to examine here, and I'll just say this, what I think is really important for people to understand, is this about sort of, again, a patriarchal structure where men don't want, husbands, fathers, brothers don't want women working with men in the workplace? Or is this about female agency where women are working in workplaces where, let's say, the overall environment is not necessarily welcoming of women? You know, sometimes, like, even, you know, when we think about the Me Too movement in the US and elsewhere, it's about women having equitable access to a workplace that is respectful, that respects women, that, you know, the conversation is not like geared towards locker room talk, things of that sort. That's something I think we need to explore further, like what's going on with the workplace. But then men given priority, almost majorities in every single country felt that men were given priorities, whether it was in Algeria, Iraq, Jordan, Lebanon, it was 47%, Libya 46%, Morocco 46%, but then Tunisia 57%. So that's something that we definitely need to look at. We wanted to just probe this further in terms of the lack of the means of transportation posing a barrier and the lack of childcare. We wanted to see if these were gendered. Did women feel the burden of this more than men? But I think the story here is that across every single country, men and women both agreed that these were serious problems. And so you see, you're not seeing very much gender separation on these questions across the region. So I think this is like a family decision. Families are deciding that it's more affordable perhaps and more convenient for women to stay at home and take care of the children. Now, low wages posing a barrier to women's entry in the workforce. Again, we don't see much gender separation. Men and women do believe that the low wages is a problem. And men being given priority for employment, again, we don't see much separation, slightly maybe. In Jordan, it's 61% female, 57% male. Tunisia, 61% female, 52% male. But in most of the other countries, the separation is not significant. And then we look at this question, which is the segregation, the mixed space. And here we were curious to see if there is a gendered difference. Like, are women more likely to say that they should be separated, or is it really men driving this? And what we found, like, take Libya, 62% of women believe that the workplace should be separated versus 58% of men. In Jordan, men slightly preferred that more than women. But in Morocco, women slightly preferred it more than men. In Algeria, women preferred the separated workspace more than men. So we're not really seeing this. It doesn't appear, at least, to be a story of men wanting to keep women out of the labor force because of separation. It seems that women want it. Now, it could be because of social sanction, that women feel that they are more empowered to work if they're in separated spaces. But it could also be that women don't want to be in these mixed spaces for other reasons. And I think we need to really figure this out a little bit more. And working alongside men posing a barrier to women's entry in the workforce, the percent that say that they agree to a great or medium extent, it's almost almost a good third in most countries. And that wraps up my presentation. Thank you very much, and I'm really looking forward to the conversation. Let me unshare my screen.
Thank you so much, Amaney. That's fascinating and very important data. And I just want to remind everybody that they can see this information on your website, correct? So is it arabbarometer.org? All right, so we would encourage everyone to go visit that Let's see, Dalal, would you like to comment or provide a perspective? You may want to unmute.
Yeah. Yeah, sure. Thank you, Rafif, for moderating the webinar today. And thanks, Dr. Amaney, for the great presentation. I'm very happy to participate in this important discussion today. What I see that the poll has a lot interesting data that we need, maybe we need more time to look into. But what I noticed that the data presented from a poll of ordinary citizens, but we know refugees are not in this category and they fell through the cracks. It's not clear to me what percentage, if any, of those polled identified as refugees. For example, Lebanon was one of the countries polled, and 20% of the population are refugees, including Palestinian, Syrian, and Iraqis, and some other nationalities. There is a similar situation in Jordan also, where there is a large percentage of Palestinian, Iraqi, and Syrian refugees. Maybe I believe in Tunisia too. The poll showed the heavy impact on Arab women during the pandemic, but of course, there is difference between the impact of COVID on women who have legal rights and the protection as citizens, and women who are refugees. ASCWA, the United Nations Economic Commission for Western Asia, warned at the beginning of the pandemic that the negative implication for refugees and displaced women will go far beyond just the risk of infection, including increased violence and sexual abuse. And this is, I believe, what we observe over the past year. Also, many reports conducted by local NGOs at the beginning of the pandemic found that there has been a large increase in physical, verbal, sexual, emotional, and also financial violence against refugee women. And this is similar to what the poll showed. Also, reports by UN agencies show that 90% of refugees living in extreme poverty. More half of those refugees are women and girls. In Lebanon, for example, where the pandemic was hitting hard for many reasons, including corruption, sanction, economic crisis, refugees were excluded from aid that the government gave to vulnerable citizens. And above of that, the government stole money that was supposed to help refugees and poor Lebanese. Reuters, I'm sure some of you read the Reuters recently reported that at least 25 million in UN humanitarian aid intended for refugees and poor communities in Lebanon has been lost to banks selling the local currency in high exchange rates. And as a result, many of the aid programs run by NGOs that help women specifically ran out of funds. And here, it's important to remember that Lebanon policies toward refugee women are part of larger discrimination against refugees in general, Syrian, Palestinian, and other nationalities. For example, Lebanon adopted a number of measurements to contain COVID-19. This included relief for poor families. However, the government support was not available to refugee women and they were excluded.
Thank you, Dalal. before we go to Lina, Amaney, did you want to respond to any of that? Because it's a particularly interesting question about the refugee and displaced groups, especially in Lebanon and maybe Jordan as well.
Yeah, so this is a very important point, Dalal. I'm very happy that you raised it. So I think, you know, and I have no doubt, and from what I've read and seen, the impact of COVID on refugee families has been very debilitating, and it's quite tragic. When we survey people across the region, we focus on nationals and not refugees. Only in wave 4 of our surveys did we have oversamples of refugees in Jordan and Lebanon. So it's something that we're looking into, but unfortunately we don't have that data. I do want to say a point about, you mentioned Palestinians in Jordan. We do survey Palestinians in Jordan because they're part, you know, they, you know, not because they're not refugee status, but because some of, you know, they hold national identification of Jordan, so that we're able to include them. What we're really missing here, Dalal, are the recent refugees, let's say from more recent refugees in the last, you know, decade from Syria and elsewhere. So that is a big issue.
Thank you, Amaney. And Lina, did you have some comments?
Yes, sure. First of all, I'm really happy to be here. And Amaney, I'm a big fan of your work with the Arab Barometer. I don't think, you know, this region doesn't like to generate data. So what you're doing actually fills an amazing gap. So thank you ever so much. My comments are in 2 parts. I just want to make a general comment on the disproportionate gender impact of COVID from a feminist perspective. And then I just want to zoom in on 2 particularly vulnerable groups. And I will take the example of Lebanon, which is the queer community and migrant women, but essentially migrant women, domestic workers. And I'll say why when I get there. So, you know, approaching the gendered impact of COVID from a feminist perspective, I mean, our entry point is always that every shock has a disproportionate gendered impact, because the starting point is a starting point of inequality, injustice. So of course, you know, the levels of vulnerability are different, but also the ability to bounce back from the shock. And I'm really, really hoping, Amaney, I think that's a very important topic for the Arab Barometer to look at maybe later on. The ability to bounce back from this shock is completely gendered. And the third thing, you know, when we talk about the disproportionate gendered impact, it's important to look at gender beyond the binary, beyond the men and women. And I think this would be our important contribution, particularly in a region that is so hermetic to looking beyond the binary, of looking of all these communities that we have consciously kept invisible and basically denied them access to their rights. So maybe, you know, maybe just to add some anecdotal evidence from the perspective of feminist activists, not just in Lebanon, but essentially, I will draw essentially from what was happening in Lebanon. But before I do this, this is a perfect example of intersectionality. In the case of Lebanon, it's impossible to isolate the impact of COVID from the horrendous economic collapse and from the Beirut blast. So there are really 3 layers of formidable shocks. And imagine, given the inequalities, imagine the formidable inequalities in the impact. So one thing, so I'm just going to very, very briefly provide some anecdotal evidence from people, from feminist activists working on the ground. One is, of course, the increase in the burden of care. And I think particularly in our region, the fact that care, the overall responsibility of care work befalls women, and if you're a little bit well-to-do, or the migrant worker, so that the exponential increase in the burden of care as a result, again, I wouldn't, I really have to repeat it, as a result of all these three. So it's not just the pandemic, but everything else. And how can we actually, there are only 2 countries in this region that actually do a time budget analysis, and that's Morocco and I think Tunisia. But we still don't know yet, we still haven't quantified yet the formidable burden of care on women and what is its opportunity cost. So that's another question. Really no pressure, Amaney, but we really want the Arab Barometer to look at this. Gender-based violence. I just want to qualify a little bit some of the amazing data that Amaney has presented. What was the impact? First of all, shelters were closed. So the only possibility, and we're talking about the places where shelter exists. Lebanon has shelters like other countries. Shelter were closed. So that possibility of fleeing violence, was no longer there. Resorting to the authorities in the countries like Lebanon that have a law that provides some protection and some intervention by law enforcement, also for a long time it wasn't functioning. That's the second impact. Access to services, and particularly to sexual and reproductive health services, was a particular, the non-governmental organizations, such as, for instance, in Lebanon, you have a major, wonderful non-governmental organization called MRSA for sexual health that provides safe, respectful sexual, and it had to close. So who was denied the services? The most vulnerable, the queer community, etc. According to many colleagues, the level of marital rape and unwanted pregnancies increased exponentially. So women's ability to negotiate their agency and their willingness or not to have sex and have children, was greatly undermined during this period. The issue of costs and economic issue, of course, there's the separate issue of the impact of livelihood, on women's livelihood. What does it mean that in our region, most of the women are the informal sector, the way the informal sector was undermined by the pandemic, etc. I'm not even going to venture there. But what we can say for sure is that women's economic livelihood was undermined greatly, especially for those who had to do the double job of doing homeschooling. And of course, we all know that homeschooling doesn't happen by itself. It's basically the women who have to do it at home. So for instance, what was, some of the things that were reported, especially for victims of domestic violence? Let's say, in the case, many women who wanted to leave and go somewhere else, and who had to do a PCR to be able to leave, they couldn't afford it. Our countries do not provide this. So it's an amazing puzzle of the violation of one right, which has repercussions on all the other rights, and on actually making that group even more so vulnerable. What happened as a result, and this again is an amazing area of investigation in terms of the gender of impact of COVID in our region. It's an amazing level. Well, first of all, the starting point of the mobilization was we cannot count on our states. These are states and regimes that in any case, like what Dalal was saying, in any case, they deny rights on certain groups, large groups, so you really can't count on them in a situation of crisis. In the case of migrant workers and the queer community, there was amazing mobilization and basically autonomous kind of ways to think outside of the box and think of solutions. In Lebanon, there's the something called the Alliance of Migrant Women Workers. It's an informal alliance. It's migrant women working in Lebanon from different nationalities. They gathered together to try to get, because also, I'll finish quickly, Rafif. I'm not going to take more time. But also what happened is that families kicked their workers outside. So they had nothing. So they gathered together, the migrant workers, to get food and to get something that, we rarely talk about in a situation of crisis, menstrual health, especially now that it has become so expensive to have your periods in Lebanon. For a poor person to have her period, it's a luxury. So these were mobilizations that, we really need to find them, talk about them, and also preserve them in our data. The queer community mobilized also in the same way, with a starting point saying, we do not matter for the government in any case, but and we're being mostly affected. Let me give you an example. After the blast, and because of the pandemic, a huge area of Beirut which was affected was actually the safe hub for the queer community, where they used to work in bars, especially for the trans community. They used to work in bars, in restaurants, where nightlife, and where sex workers were. Because of social distancing, etc., and because of the destruction, all of these peoples are on the street. And it was the initiatives of individual queer activists that made that actually saved the lives of so many people, because they were disproportionately affected by COVID. So to conclude, and of course, let me just add the vaccine injustice. All of these people I'm talking about, we had official statement made in Lebanon saying the vaccine is just for Lebanese, and the refugees have to figure it out. So to conclude, what I want to say is just 3 quick points. Our starting point is the injustice itself, and therefore everything that has happened, the gendered impact, is a story of a death foretold. We could have, every feminist on the planet could have. Secondly, it's exacerbated by dysfunctioning states that in any case are broken and are not there to fix things. And then thirdly, and I think this is where I want to end with a positive note, is that we have seen not just, I like to use more citizens and residents actually pulling together and addressing the disproportionate gendered impact. So thank you ever so much. That's and no pressure, Amaney, but there are 20 other subjects. We're begging you to work on them, please.
Thank you so much, Lina. As you so accurately put it, this is like a puzzle, and we just continue to see these ripple effects. And so clearly, Amaney, your work is cut out for you, because you're sort of overcoming some of those barriers to understanding gender issues across the Middle East. So we encourage you to please keep going. We do have some questions from the audience. So let me just start by saying, Lina El Ali says that she noticed that Lebanon dropped off many slides in your presentation, Amaney. Is there a reason for that, or does Lina need to go back to your website to check the data?
So I'm just going to, so Lebanon is in our data for all 3 of the waves. So I'm not, I'll go back and look to see where Lebanon dropped off. But all the data is on our website, so please do look there. If there's a particular area where Lebanon dropped off, I'm just going to look here really quickly. It's in all of our slides, except I think on the, you're right, on the family arguments. So let me get a little bit more information about that and get back. So okay. Yeah, one of the reasons is that the way we conducted the Lebanon survey was that the first 2 were sort of simultaneous. So that's probably why they dropped off the slides. But nevertheless, we do have data on these questions on our website.
Okay, thank you for that.
Okay.
Dalal, maybe this is a question for you. What policies, and this comes from Mayaj Bailey, what policies should leaders or stakeholders across the region implement to ensure that the post-COVID recovery is not marked by the same gender disparity we've been discussing? Unmute.
I believe that changes should be made on different level for the post-pandemic. Improve the support for international community to provide assistance for refugees when the host countries will not do so. So this includes appropriate protection for refugee women and girls from all forms of violence and abuse. We must include the refugees in discussion of vaccine equity, as Lena said, they are not given the vaccine, or they are not on the priority level. A large number of refugees are still not vaccinated. Need to end the economic sanction on countries that suffer from war and internal conflicts. These sanctions hurt the poorest and most vulnerable, especially refugees, not the governments or official in power. And finally, I believe it's important to add a figure to future polls. Amaney promised, and maybe we'll see something in future.
Great, thank you, Dalal. Lena, would you like to add to that? It's basically we're asking any recommendations for policymakers or stakeholders to make sure we address these gender gaps in the post-COVID era. And then Amaney, I'm sure you'll also want to weigh in, but go ahead, Lena.
Yeah, I mean, just to continue on Dalal's point, being part of the decision and policy making which relates to our health and our future and our opportunities and life chances. And I think this applies to all the communities that we keep, by design, we keep invisible. And we keep making decisions. And Dalal made another important point. International aid targeting refugees hasn't really trickled down very well to the refugees. So I think the policy making is at the level of regimes which we know very well we are very porous when it comes to international aid, never goes to who it is intended to go. What I would add to what Dalal was saying is being at the table of the decision making and influencing the international community. We know very well what is happening. They know very well what is happening. And I think how do we shift the needle is my recommendation to confront. We have the data and we have the testimonials, basically to confront international aid with policies that are that have been more or less a failure in bringing rights to invisible people.
Thank you, Lena. I know, just being Syrian, how difficult this has been in Syria. If you want to talk about a lack of transparency and an inability to make sure assistance is provided to those who are most vulnerable, and of course that's always women. And I guess the bigger challenge is making sure that women have a seat at the table so that they can have more of an impact on those international donors. So Amaney, any comments on all of this?
Yes, I just want to concur with what Dalal and Lena said. I mean, these are very this is spot on, obvious advice. My bigger concern is that these a lot of the regimes in the region are simply not are not listening, and it benefits them when these marginalized communities, if you may, whether they're women, refugees, the queer communities, the migrant communities, when these communities are sort of not only invisible, but outside the realm of policy making, it narrows the constituency that these regimes need to cater to, which are the more formal ones. So in a way, it's a win-win. So that status quo is a very difficult one to break. that's why I, as a political scientist, that's a nice formula for regime durability. And so the question then becomes, especially for, I guess, this audience here today, like what role can maybe international donors play in this, try to sort of change that equilibrium and move things forward. And just going back to the issue of women, I think it's really important to ensure that women have agency, women are able to, to make achievements and advancements in their lives that will enable them to be less dependent on these, this formal equilibrium, if you may, that continues to disadvantage them. Getting women opportunities to be in the labor force, I think, is very important in that regard. So, and this is something that, is squarely something like, donors can sort of like really look at objectively, which is like, creating labor force conditions that are more conducive to female participation, encouraging regimes. And this would also, of course, trickle down to all marginalized communities, the refugee population, the migrant population. Too often the debates about the Middle East have focused on the cultural barriers, or the quote unquote, the democratic deficit. Like once the Middle East becomes democratic, then women will have their rights. Once the Middle East becomes culturally progressive, as if the whole world was born culturally progressive, then women will have their rights and marginalized communities have their right. No, but we also see that active policy making and equitable policy making improves the daily lives of ordinary citizens, especially women. And that's why I think a lot of pressure needs to happen.
Thank you. I wanted to go back to one of your slides. Amaney, you were talking about the percentages of women who were saying that they felt that their families were more unified and maybe the household became less argumentative. And I know you're scratching the surface of the research in the MENA region, but I wonder if the women aren't making those claims out of fear of a retaliation by their husbands. Is that something that falls into the realm of possibility? And I would ask you and Dalal and Lina to comment on that.
Yeah, no, that's a really interesting question, Rafif. I mean, I don't see anything in the data. I mean, oftentimes we run some correlations. We sort of look at other patterns of the responses. Like, I don't see anything in the data that would lead me to believe that this was less than genuine response to this question. And I'm thinking about at least the way and again, Dalal and Lina have lived through COVID in the region, so or understand it better through their research. But my sense is that a lot of families also, spent time together, created their own family bubbles. And in a way that reliance and dependence on family networks, which is probably net positive and net negative for women, because if we think that women are already embedded in these patriarchal networks and because they can't rely on states and they can't rely on labor markets, that it probably rendered women more dependent on the family. I think maybe some of that is going on here.
Great. Dalal, anything to add? You're on mute.
Okay, I think that look, the pandemic wasn't easy. The combination of economic crisis and COVID-19 has made the refugee women even more vulnerable than I said before. Refugees like communities like those in Lebanon and Jordan suffer from extended displacement that they have been refugees for decades. Poverty, lack of education, protection, economic crisis led to early marriage, child marriage. This is seen as a way for poor families to save some money. Many houses, refugee cannot afford rent now. Food is not available or expensive to buy, pandemic has had major impact on informal labor performed by refugee women. In general, refugee women are less likely to be employed. And when they have been lucky to be employed, they have low-paying jobs that are usually daily labor. These don't have any benefits or social protection and barely support their basic rights or the basic needs, I mean, but were very important source of income for their families. And when the pandemic started and the lockdown were imposed, refugee women were the first that were forced to leave, unfortunately, jobs.
Right, very, very true. And I guess we've seen a pretty significant rise in begging and peddling and street selling. Lena, did you want to continue on that thread?
Yes, I just want to go back to also to Amaney's point. I mean, I would say there have been several trends in terms of how family as an institution was, impacted by COVID. And I think for families where with decent, might I say, relationships of mutual support, etc. Of course, this came as a time for more cohesion, etc. But I want to go to the families where women live and children live with the abuser. In Lebanon, for instance, at the beginning of the pandemic, in April 2020, 6 cases of spouse homicide took place. 6. In a small country like Lebanon, this is huge. By the way, no justice was rendered for any of them, which again is another layer of injustice. So I think maybe what I'm trying to say is, I think what the situation was before COVID in terms of social relations, it was exacerbated during COVID and amplified because of no choice but to live under the same roof 24/7. And also, just to add one last thing, again, for me, what is interesting is to see what kind of mobilization was done. Feminist organizations working on gender-based violence did some amazing awareness raising for women in abusive situation, what to do during COVID. And also, I mean, I would really invite all of our listeners to look at this, to look at an amazing video that Daraj Media has done with one of our best and finest feminist journalists, Maya Ammar. They did something specifically targeting women. What do you do? What do you contact? What kind of behavior should you kind of prepare yourself with when you feel the level of violence escalating? Because that was the only recourse. The only recourse was what the kind of interventions that were done by active groups on the ground.
Thank you, Lena. Could you repeat the name of the organization so people can look it up and get more data?
Sorry, Daraj Media.
Daraj Media.
Daraj.
All right.
And these were kind of videos which were done, and they did another video which was the experience of queer folks during the pandemic. And the journalist is called Maya Ammar. Maya
Ammar. Okay, thank you for that, Lena. We're just about out of time, so Amaney, maybe you can tell us really quickly what your future research and surveys are going to entail, and we'll ask you to close us down today.
So I'm very excited. First of all, I want to thank again, MEI. Thank you for moderating, Rafiq. Thank you, Lena and Dilek, for your outstanding comments. I also want to give a shout out to my colleague Val Mogaddam, who wrote in on the Q&A. She's been writing on this topic of the structural impediments to female labor force participation since the 1990s. So we're building on her tremendous work in this area. But I'm very encouraged by this conversation because, one of the things that Lena and I have talked about on our offline conversations is that we in the Arab Barometer want to benefit from these very, very sound, informed, very contextualized, very fine contextualized nuances on the ground. And we want our surveys to be able to provide academics and scholars like Dalal and Lina and MEI who are working in this area with better data. So I'm really encouraged by developing our questions and working in partnership with all of you. Thank you.
Well, thank you, Amaney, and thank you to the Arab Barometer for this important work. And Dalal and Lina, thank you for your very critical and important contributions to this body of work and what you're doing separately. And thank you so much to the Middle East Institute for hosting us today and continuing to shed light on issues of gender across the Middle East. Thank you, everyone. Thank you for those who submitted questions, and have a wonderful rest of your day. Thank you very much.